Hi, my name is Katelyn Lawler. I'm a certified wound ostomy continence nurse at Einstein Medical Center, Montgomery in East Norriton, Pennsylvania. I am presenting on improving turning compliance and reducing pressure injuries in the acutely ill patient. This was a 2019 Delaware Valley Patient Safety and Quality Award. So we did a program called the LEAF Patient Monitoring System. A background on LEAF. LEAF is a sensor that is worn on the patient's chest, which monitors their positioning, their movement and activity throughout their hospital stay. It's a monitor that is worn by a select population of patients to help reduce hospital-acquired pressure injuries. So why we chose LEAF. Our goal was obviously to reduce hospital-acquired pressure injuries in our facility and improve our turning compliance at Einstein Medical Center, Montgomery. For reference, a pressure injury that's hospital-acquired, especially in the ICU, can cost as much as $32,000, even more, but that's about a standard range. So that was our big driving factor for starting this initiative. So our method, we started in the ICU. We did a 6-month pilot in our ICU. We received this pilot through a grant. It is a costly program. It's $200 a sensor roughly. However, through our grant, we were able to expand our pilot for 6 months. After our pilot in the ICU, we saw such good results that we did expand this program out hospital-wide. So we do actively purchase these sensors each month. However, the equipment, like the monitors and the hardware and the wiring, was all provided by LEAF Healthcare. So basically what the method is, our criteria for placing a patient on these was a Braden score of 16 or less, a current pressure injury, a history of a pressure injury, or the inability to self-reposition the sacral area while they were in bed. Basically, after that sensor goes on the patient, it'll go up to the monitor as seen in this picture, and you'll kind of see green, yellow, or red. Green means that the patient is in with a safe zone and they've been turned within the past 2 hours. Yellow means you have 15 minutes and then they're going to be due for a turn, let's start preparing. And red means they're overdue. As you can see next to the green, yellow, and red, you see upright, you see prone, so you can really know what that patient's doing, including ambulating. It will give you a little walking man symbol if they're ambulating. You can also restrict a side. Let's say a patient comes in with a left hip pressure injury. You can restrict that side on the monitor, and it will show up red if they're put into that position. Our results. So during our pilot, we saw 0 hospital-acquired pressure injuries in our ICU. For fiscal year 2020, hospital-wide, we had 13 hospital-acquired pressure injuries. However, 0 of those patients were on the LEAF monitoring system. And we saw a return of investment of $185,000 for that year. I would say one thing that made this so effective is that our staff really bought into it. They thought it was a great thing. It really gave our nursing aides independence in repositioning these patients, and they were very integral in this program. And also we had really good support from our administration and director level staff members. In closing, using wearable technology to cue patient repositioning was cost effective and significantly reduced TAPI incidents in our hospital. High adherence to turn protocols is sustainable in the long term. And that's all. Thank you.